Hi, this is Dr. Daljeet. I'm a consultant psychiatrist in Hyderabad. Today, I'm going to talk to you about women's mental health. A lady embarks her journey with several challenges ahead her, be it biological, as in terms of hormonal changes in the body, or the social stresses due to the different roles she plays in life. Mental health and empowerment are two essential needs for a woman. Women are susceptible to specific mental health risks, but seeking help becomes too stigmatizing for them. The objectification of women in today's society doesn't help either. It just adds on to the stress of, anxiety and eating disorders in women. I'm of the view that mental health awareness among men and women will encourage women empowerment. Therefore, today I'm going to talk about mental health in women and mainly focus on the biological factors. Evidence suggests that women are more likely to experience mental health problems like depression, anxiety, post-traumatic stress disorder, and eating disorders, almost like 2 times compared to men. Women are vulnerable to depression in different stages of their reproductive life. This can be divided further into premenstrual, perinatal, and perimenopausal. It could be due to the changing hormones, estrogen and progesterone in their body and their influence on the brain function and stress response. Let's start with the premenstrual part. PMS. We all know about PMS. Premenstrual syndrome is very common. Almost 4 in 5 people can experience PMS. But there is a small number, a subset of women with premenstrual syndrome who might have disabling symptoms every month. This form of PMS is called premenstrual dysphoric disorder, PMDD. The signs and symptoms of premenstrual dysphoric disorder may include depression, mood swings, anger, anxiety, feeling overwhelmed, difficulty concentrating, irritability, and tension. Studies have shown that antidepressants working on the serotonin receptors can play a very important role in managing premenstrual dysphoric disorder. Let's talk about pregnancy. Pregnancy is a time to celebrate, thrive, and glow, but there are a few who silently suffer from depression and anxiety. Untreated depression can be harmful not only for the mother but also for the child. Therefore, they should not be ignored, and a professional assessment by a psychiatrist becomes mandatory. A psychiatrist can also monitor you during your antenatal period, during pregnancy, and in the postnatal period. There are also few medications that can be used during pregnancy and breastfeeding if it really becomes important to treat medically at that point of time. Postnatal depression and puerperal psychosis. Well, postnatal depression is very important. It's a common phenomenon, and you're more likely to be experiencing postnatal depression if you've had an episode of depression in the past. Postnatal depression is often mislabeled as a normal experience or an adjustment to childbirth. This is because of the ignorance and lack of awareness. Baby blues are normal experiences, not postnatal depression. What are baby blues? Well, in the first 2 weeks post-delivery, some women can experience, being anxious, tearful, and feeling down. This often gets better as they adjust to the process. But if the symptoms last longer or start later during the postnatal period, you could be having postnatal depression. The earlier it's diagnosed and treated, the quicker you will recover. Symptoms of postnatal depression could be feeling very sad and hopeless, losing pleasure in doing things, negative thoughts about yourself, not sleeping well, losing your appetite, losing your concentration. Postnatal psychosis or puerperal psychosis. This is a very rare condition, as rare as 1 in 1,000, but it is a very serious issue. I've had few patients admitted and treated for puerperal psychosis. Here the mother may be at risk of harming herself or others, including the baby or other children. Recognizing symptoms and seeking urgent help is essential here. Symptoms could be as alarming as dreams about harming your baby, overwhelming fears of dying, feelings of guilt that you're a bad mother, excessive worry about your baby's health, and many more. To summarize, we have today focused on the biological factors that affect a woman's mental health. In the next video, we will talk about the perimenopausal symptoms, menopause, midlife crisis, and the effect of various physical comorbidities that contribute to the mental health problems in that age. Thank you.